Dr. Marlene Diedrich. We're going to talk today in this online program about sleep and metabolism. We'll go over a little bit first about what is a normal amount of sleep to get. We know that most people need about 7 to 8 hours of sleep, and we know that too little sleep and possibly too much sleep on a chronic basis can be detrimental to your health. Very short sleep times are linked to obesity, high blood pressure, and blood sugar abnormalities. Some people just develop a problem with glucose intolerance or insulin resistance, but those can be precursors to type 2 diabetes. Very short sleep of less than 4 hours has been linked to actually increased mortality, and very, very long sleep, more than 9 hours on a consistent basis, may increase mortality as well. However, most people are not in those categories, and they're probably suffering from a lesser form of sleep deprivation and not the extremely long sleep times that we're mentioning here. On average, the optimal amount of sleep time seems to be about 7.5 hours a night, but there is a very wide range of variability. So there are people that can get away with 4 hours and feel just perfectly fine, and there are people that may need 11 or 12 hours, and that is the best amount of sleep for them. So it's best not to pay too much attention to the exact numbers that we're talking about, but to pay attention to what makes you feel good in terms of your energy level and how rested you feel. Many of us in the U.S. and in developed countries are sleep deprived. There was a 2008 Sleep in America poll that showed that 44% of working adults are getting less than 7 hours of sleep per night, and 16% are getting less than 6 hours a night on average. Now, many times this is not because people have insomnia, although that can be a factor. A lot of times it is self-imposed sleep deprivation, in which people simply are not getting to bed at a reasonable time because they think they have too many responsibilities and too many other priorities. Back before the light bulb was invented, people probably got more than enough sleep, and in fact, in medieval times, people would often be sleeping or at least lying down for maybe 12 hours out of 24, but they would have some periods of wakefulness during the night in which they would just lie there and rest, and then they would go back to sleep for a while and get up when the sun was up. In modern times, we are very subject to cues from our environment and responsibilities in our family and our work life, which cause us to be sleep deprived. We know that chronic sleep deprivation is associated with a lot of negative health effects, including diabetes, high blood pressure, and heart problems. Obesity is very closely linked to sleep health. There's a strong connection between sleep apnea and obesity, and also between sleep deprivation and obesity. When we use the term obesity, we're referring to a body mass index of 30 or more. When we use the term overweight, we're referring to a body mass index of between 25 and 30. In the U.S., the prevalence of obesity has been increasing gradually since the early 70s, and it now affects well over 30% of the population. The prevalence is actually even higher in women than in men. We also know that there's an evolving problem with obesity in childhood, and there's been a concomitant increase in sleep disorders in children as well, primarily in sleep apnea, but also in sleep deprivation. A lot of children now are staying up later and later, working on the computer and watching TV. They're becoming more and more sleep deprived, and there probably is a link between that and the development of childhood obesity also. So it's not just the candy machines at school, but the TV that they're watching at night at 10 o'clock probably. There's been a simultaneous association also in adults, of course, between sleep deprivation and obesity. We know that obesity worsens sleep quality, and in some very basic ways. That would include having a little bit more difficult time getting to sleep in the obese individual, decreased sleep efficiency, which means that the amount of time they're spending in bed is less of it is spent actually sleeping, and also they tend to have somewhat less REM sleep than a person who is not obese. Heavy upper body, or what we call truncal obesity, definitely increases the risk of apnea, which worsens sleep quality. Patients that are obese are much more prone to something called obesity hypoventilation. That's a disorder in which people that are not necessarily having sleep apneas may actually just not be moving air very well during the night in general. And that is associated with dropping oxygen levels and increasing carbon dioxide. And in very severe cases, people can have elevated carbon dioxide in their blood during the day as a result of that, and that may contribute to daytime sleepiness as well. People with obesity, and especially obesity hypoventilation, have a higher risk of right heart failure and pulmonary hypertension, which is a little bit different than the usual term hypertension. Pulmonary hypertension refers to elevated blood pressure in the vessels of the lungs. Patients with obstructive sleep apnea or other causes of sleep deprivation are at an increased risk of obesity, diabetes, and even glucose intolerance. One possible reason for this is that an obese individual may be too tired to exercise. People with sleep disorders are too tired to exercise, and so that can contribute to their obesity. People that are sleep deprived for various reasons, including sleep apnea, are subject to problems with hormones in their blood that affect appetite. Leptin is a hormone which suppresses appetite, and when that is suppressed, that can increase obesity. And ghrelin is another hormone which actually stimulates appetite, and that can be increased by sleep deprivation, and that can result in worsening obesity as well. Now, people that are sleep deprived will have the lower leptin and the higher ghrelin levels. People with sleep apnea actually have high leptin levels, but that may be actually associated with something called leptin resistance, which is kind of on a similar idea as insulin resistance. Sleep deprivation seems to stimulate eating high-calorie, high-carbohydrate foods. So we know that people that are chronically tired, they often are not going to go get a snack that's a carrot stick. If they're trying to stay awake at night and they're very, very tired, they will go get the candy bar or the chips or something that will try to keep them awake for a little bit longer, and those typically are very high-calorie, not very healthy foods. There's some animal data that suggests that eating at the wrong time of day, even without changing total caloric intake, can cause weight gain. There was a study done with mice, actually, in which two groups of mice were fed the same number of calories. One group got them at the time when the mouse is supposed to be awake, and the other ones got the calories at the time when the mouse is supposed to be asleep. And the ones that got the calories at the wrong time weighed more than the ones that got the calories at the correct time. So we think that there's probably an association between that type of thing in humans, and that eating late in the day when you're supposed to be sleeping is probably not going to help your weight. We know that poor sleep quality or poor sleep or not enough sleep at all contributes to other hormonal problems, and there may be a link between sleep deprivation and disorders such as polycystic ovary syndrome. There's a very clear correlation between obstructive sleep apnea and high blood pressure. Apneas during the night are associated with repeated cycles of slowing of the heart rate and then increasing of the heart rate, and that results in repeated increased levels of stress hormones being released. Those stress hormones are things like cortisol, which can elevate the blood pressure and contribute to other effects on the body. We know that repeated arousals during the night by other disorders such as periodic limb movements can also cause the same sort of effect on stress hormone release, and probably can also be associated with elevated blood pressure or hypertension. Obstructive sleep apnea is associated with a higher risk of heart problems. There's a higher risk of certain cardiac rhythm problems, in particular atrial fibrillation with obstructive sleep apnea. There's also a higher risk of congestive heart failure, and that can include both the usual form of congestive heart failure as well as what's called right heart failure. There's an increased risk of heart attack in patients that have sleep apnea. We also know that sleep apnea increases the risk of stroke, and likewise, or conversely, people that have had a stroke are at a higher risk for sleep apnea. So in patients that have had strokes that are in the hospital, we're now paying closer attention to whether or not they should be screened for sleep apnea. There are also some other areas of investigation going on, looking at links between sleep apnea and other health conditions. One of these is a possible link between sleep apnea and glaucoma. There's also an apparent link between patients that have elevated intracranial pressure and sleep apnea. So patients that are coming in to see their doctors with various other health conditions sometimes are appropriate to be screened for sleep apnea. If you are suffering from any of the conditions that we discussed, and that would include obesity, hypertension, cardiovascular disease, stroke, and some of the other conditions, you may wish to talk to your doctor about whether you might be at risk for sleep apnea. Screening can include, of course, taking a good history and looking at answers to a sleep questionnaire in which we can gauge whether you really are more sleepy than normal during the day. An examination would be done, and looking at the structures of the neck and looking at your weight and whether or not you're in a category of overweight or obesity. And then there might be some other screening tests done, such as an overnight oximetry, which would look at your blood oxygen saturation level during the night to see whether there might be a clue there that you're having too many dips and you might be suffering from sleep apnea. If it's considered appropriate, you could be referred to a sleep center for a sleep study and possibly referral to a sleep specialist. We hope this improves your sleep quality and raises your awareness of sleep disorders.